After serving in the Army, damaging his knees, undergoing 20 surgeries, and relying on opioids, retired paratrooper Doug Rod's life has changed thanks to something called DRG therapy. He joins us now to talk about his story along with interventional pain specialist Dr. Corey Hunter. Thank you both so much for joining us.
Thank you for having us.
It's nice to have you here. So, Doug, I want to get to your story here in just a little bit, but Doctor, we're talking about something called complex regional pain syndrome. Can you describe what that is?
Sure. We usually abbreviate it as CRPS. It's something that not a lot of people have heard about unless you yourself are unfortunate enough to have it, or you have a family member or know someone with it. Patients that have it often call it the suicide disease because you'd rather not go on living another day or hour than have to deal with the excruciating pain that it's in. And what's so frustrating about it is we don't know really why one person will get it and another one won't, because it starts off with something so simple as, just a really, innocuous injury or a basic routine surgery. The body heals, but then what'll happen in some cases is the pain just continues. And it'll progressively get worse and worse until, like, months later, the person won't really be able to use their limb anymore. So what's frustrating is we don't know why that happens in some patients and not in others.
Right. And Doug, you were injured serving our country. And first of all, I want to thank you so much for your service and everything that you did, all the sacrifices that you made.
Well, thank you. It was an honor.
And having said
most of my injuries were related to my service and subsequent surgeries. And then I ended up with a knee replacement at an earlier age than most. And at the end of that course of action, I ended up with the complex regional pain syndrome, where my leg would just swell uncontrollably, and oftentimes I just could not manage the pain. And so the only way to manage the pain would then be to use medication, used a spinal stimulator, periodic spinal injections, that sort of thing.
Right. And doctor, there's a new type of treatment, like I mentioned at the top, called DRG therapy. Can you describe what that is?
That's right. It's called Abbott's DRG stimulator. It's the first of its kind because for the first time we have a proven and effective treatment for not only complex regional pain syndrome, but a variety of different types of chronic pain, which can include pain after surgery, chronic foot pain that's related to nerves, post-amputee pain or phantom limb pain, which is traditionally something we've never had a treatment for, something like a groin pain after having had a hernia repair, pelvic pain. And what makes it so unique is that we can actually focus it to a specific body part and really concentrate the therapy. In a nutshell, really to describe it, everyone's heard of a cardiac pacemaker. But instead of focusing the signals into the heart, we're just focusing, small little electrical impulses into the nervous system, which a patient really can't feel, to alter the pain signals. So it's really, these patients, for the first time, I can look at someone in chronic pain and tell them, look in their eye and say, like, there's a really good chance I can give you your life back, and you're not going to need that medication anymore.
Right. Doug, how has this therapy changed your life?
I love the phrase that Dr. Hunter used about getting your life back. It's amazing the difference. And I'm going to give you an example. Last night my wife and I walked 3 miles, enjoyed a nice leisurely stroll, and I have never, well, not never, but it's been at least 15 years since I've been able to walk that far.
Wow, it warms my heart to hear that you're doing so much better, that you're able to enjoy the little things. That's what makes up life, is just taking a 3-mile stroll with your family, and I'm so happy to hear that. So I want to thank you both so much for joining us. Doug, for sharing your very important story, and Doctor, for the information. Thank you both. And stay where you are. We'll be right back.